Hey guys, this is Chapter 1, Lecture Part 4. Today we're going to talk about chain of custody. Chain of custody, when we refer to chain of custody, we're talking about the documentation of sample handling. So with chain of custody, it's going to start with the patient identification and it's going to end with the actual results being reported, okay? So there's special forms that are provided and must be completed to track the sample handling. These forms include the date, the time, the identity of the person handling the sample. So there, from the start to finish, there's a series of forms that follows the specimen from the time that it's collected till the time that it's actually reported off. And the most common tests that we refer to or that we think of when we think of chain of custody is going to be blood alcohol levels, drug levels, DNA analysis. And the reason being, if a person is in a car accident and they come in and their sample is skewed or it's messed up, they've been in a car wreck, somebody's been killed, and this person has alcohol in their system, but they're trying to pay somebody off in the lab, or they're trying to, they're doing things to try to skew the results so they can get out of whatever trouble they're in. The chain of custody monitors this type of lab very closely. The same with drug levels and DNA testing. All right, we're going to talk about safety precautions and infection control now. Healthcare associated infections are also known as HAIs, okay? Capital H, capital A, capital I. So if you see the term HAI, this is a healthcare associated infection. This infection is acquired by a patient as a result of a healthcare procedure. So with that being said, it's acquired in the hospital. Infection control groups such as the CDC, they work to prevent these HAI infections. The majority of HAIs are caused by the collector not following the established infection control procedure. So it's very important that you guys make sure that you understand the infection control procedure. Next, we're going to talk about chain of infection. If you go over this slide, it's going to talk to you about the chain of infection. The chain of infection is completed when you actually have a source, a mode of transmission, and a host. And I want you guys to look on page 5. If you look on page 5 in chapter 1, this goes over the chain of infection and everything that is required to actually get an infection. So you have to have all of these in order to have an infection. So you have that infectious agent, which is bacteria, fungus, parasite, viruses, and then you have the reservoir. The reservoir serves as the human, the animal, the insect, the fomite, or blood or body fluids. So that's where you find that the reservoir is where you can find that bacterial agent. And then you're going to have a portal of exit, which can happen at the nose, mouth, mucous membranes, or at the site of a sample collection. And then you have means of transmission, which are droplet, airborne, contact, vector, and vehicle. And then again, you have a portal of entry. The portal of entry is the nose, mouth, mucous membrane, skin, unsterile equipment. And then you have that susceptible host, which could be your patient, an elderly patient, newborn, or an immunocompromised patient, or a healthcare worker. And you can see that a break in any of these links, if you look on page 5 at those blue boxes, a break in any of these links can cause an infection. So if you have that reservoir and you're not performing hand hygiene, you're putting the patient at risk. That's a break, okay? Hand hygiene, if you're not properly wearing your standard or your PPE, if you're not using sterile equipment, if you're not keeping the patient isolated, if they're on isolation precautions, if you're not following those isolation precautions, again, you are breaking the link, and you can cause an infection. Standard patient precautions include the PPE, such as your PPE, which is your personal protection equipment, isolation procedures, hand sanitizers, properly activating needle safety devices, which I'm going to show you guys in the lab what we're talking about with needle safety devices. If you're not properly decontaminating your equipment, and so making sure that you're cleaning everything appropriately is you should do, because contaminated material should be disposed of in biohazard containers. You need to always remember to decontaminate any surfaces. One thing that we use, a decontaminant that's used often, is the sodium hypochlorite. If it's diluted, it can be diluted at a 1-to-10 ratio or a 1-to-100 for routine. So this solution is prepared daily, and it's stored in a plastic bottle. Anyway, it is the recommended disinfectant for blood and body fluid contamination. So know that about sodium hypochlorite. I would like for you guys to read about it and make sure you're up on what it does. PEP. If you experience a needle stick, we need to think PEP, okay? PEP stands for post-exposure prophylaxis. P-O-S-T, exposure, E-X-P-O-S-U-R-E, prophylaxis, P-R-O-P-H-Y-L-A-X-I-S. Prophylaxis is a preventative measure that is taken. So if you receive a needle stick, they can start you on PEP to try to prevent your body from accepting any kind of infection that you may have gotten from that. So think PEP when you're thinking a needle stick injury. And last but not least, we're going to go over the transmission-based precautions. Please take a good look at this slide. These transmission-based precautions are very, very important, and guys, you will see them again. With an airborne precautions, you use standard precautions plus a mask or respirator. With droplet precautions, you use standard precautions plus a mask. And with contact precautions, you use standard precautions plus gown and gloves. So we can see our airborne is the real fine particles. That's why you would use a respirator, because you can catch this by breathing it in. So tuberculosis, measles, chickenpox, herpes, mumps, and adenovirus, these are all airborne. Your droplet precautions include the Neisseria meninginitis, pertussis, whooping cough, group A strep, the influenza, rhinovirus, scarlet fever, parvo, B19, respiratory syncytial virus, and diphtheria. And then the contact precautions is going to be your C. diff, Clostridium difficile, rotavirus, antibiotic-resistant infections, scabies, impetigo, herpes simplex, and respiratory syncytial virus. So please take a good look at this slide and know these, because you will see questions related to those.